Now, nuclear medicine is when we use radiation in healthcare, and there's two ways that we can use radiation. One is in diagnosis, and one is in treatment. So when we're doing diagnosis, so we use nuclear imaging, we're going to see what is inside the body. So to see what is inside the body, the patients are given from radiopharmaceutical drugs. So radiopharmaceutical drugs are drugs that contain unstable isotopes, and these unstable isotopes, they will combine with biologically active compounds, and this is what makes the drugs. Now, these drugs will be delivered to specific areas of specific tissues or cellular receptors. So wherever there is any problem, where it is suspected that there is any problem, so for example the lungs, the liver, the kidneys, the bladder, so these drugs will go to these specific areas and they will undergo decay. And when they undergo decay, they produce gamma rays, and these gamma rays, they leave the body. And when they leave the body, these gamma rays will be detected by the scanner, and it gives an indication of the internal organs. So if we look at the different types of radiation, alpha, beta, gamma, you have the penetrating power. Penetrating power is how many layers it can go through easily. So if you look at gamma, it has the highest penetrating power, which means that you can see here gamma can go through skin, can go through multiple layers. But alpha has the lowest penetrating power, which means that it's going to stay inside. If there is an alpha emitter, the alpha particles will stay inside the body, and beta is going to go just barely go through the skin. So the penetrating power of gamma is the highest, but for gamma, the ionization density is the lowest. So ionization density is the ability of the radiation to harm or damage cells. And alpha has the highest ability to damage cells, while gamma has the lowest ability to damage cells. So this means that it can cause cancer or it can kill cancer cells. So alpha particles, if it is exposed to healthy cells, the healthy cells can get damaged, so it could cause cancer. Gamma produces the least risk. So if we look at imaging, when we're doing imaging, we will try to focus on gamma rays because it has high penetrating power, so it's going to go through the different layers of skin, and it has lowest ionization density, so it's going to cause the least damage to the cell. So when we do this, so we use generally technetium in the metastate, like I mentioned before. So metastate means that it is in the excited state, and it's going to decay and produce gamma radiations. So if you have the body here and we want to see if there is anything wrong with the kidneys over here, so the drug, the radiopharmaceutical drug, will be delivered to the kidney, and when the technetium goes in there, it's going to produce gamma rays. These gamma rays will be detected by the scanner or the X-ray machine, and it's going to produce an imaging of inside the kidneys. Right? And these substances usually have a half-life that is just long enough for the scan to be completed before it decays. Half-life is the time that it takes for the amount of the substance to decrease to half its amount. So if we start with a node, let's say that's the initial amount, so half-life will be the time that it takes to decrease to half. So this will be 1 half-life. This will be 2 half-life. So this is A by 4, A node by 4. Then you would have 3 half-life. 3 half-life would be 8 node by 8. right, as such. So normally when it decreases to half its amount, so the concentration of the drug is decreasing. So half-life should be just long enough for the scan to be completed, and it should not be too long as well, else it's going to spread radiations. Now, another section of nuclear medicine is treatment. Yes, it's good to diagnose, but there is also treatment. And treatment is radiotherapy. So there's two types of radiotherapy. There's internal radiotherapy and external radiotherapy. In internal radiotherapy, we're going to have specific radionuclides that are inserted inside the body, and this can be done in the form of metal wires or pellets that deliver radiation directly to the site of the disease. So in the site of the disease, you can have, let's say there is a problem. So we've done imaging and we found that there is a problem in the kidneys. So let's say this is the kidney, right? So we're going to have a drug that is going to go into the kidney. Now, this drug is going to emit alpha particles or beta particles. And we've seen that alpha particles have low penetrating power, but have high ionization density. Now, those healthy cells, let's say these are the cancerous cells, and let's say the white one are the healthy cells. So the healthy cells are going to be a bit far apart. So then the beta particles or the alpha particles do not reach these healthy cells. They only reach the cancerous cells, right? Only the cancerous cells around the source, right? So they have low penetrating power, so they will not spread out everywhere, but they have high ionization density. So they can be harmful to the cancerous cells. So you have alpha emitters and beta emitters. We're going to see that in a little bit more detail. And then you have external radiotherapy. External radiotherapy is when you have a powerful source of ionization radiation that is concentrated into an area where there's cancer from outside. So you can see here, this is the gamma knife. So you have radiations, and the radiations are concentrated into the area of damage here, into the cancerous cell. Now, normally, cancer is caused when there is errors in DNA sequences, and these errors are passed on to other cells through division. And these rapidly dividing cancer cells are very sensitive to genetic damage, which means that if you have alpha particles or beta particles which have high ionization density, the cancerous cells are very sensitive to these radiations, to alpha and beta radiations, and these radiations will cause those cancer cells to die from radiation exposure. So it makes them more likely to die than normal cells. So this is why when those cancerous cells here are exposed to the alpha particles, they will die here. However, the disadvantage is that normal dividing cells are also sensitive to those DNA errors that can be induced by the ionizing radiations. So during radiotherapy, hair follicles are damaged as they contain one of the fastest growing cells in the human body. And this can often cause hair to fall. So the hair falling is not because of the cancer, but it is because of the radiotherapy. Other side effects include skin, nail damage, nausea, fatigue, and sterility. And long-term risk of radiotherapy is the development of secondary cancer. So you can induce errors in healthy cells and cause cancer in other areas of the body. So this is why it is normally we normally target those radiotherapy. And one way that this is done is by targeted alpha therapy. And this is a form of radiotherapy where you have dispersed cancer. So the cancer is spread throughout the body. So what happens is that you have alpha emitters such as lead-212 or actinium-225 that are delivered by carrier drugs to the target cancer cells. And these cancer cells will be exposed to the alpha particle radiation, which has low penetration, which means that the alpha particles do not spread to healthy cells, but these alpha particles have high ionization and density, which means that they damage the cancer cells a lot without damaging healthy surrounding cells, without significant damage to the healthy surrounding cells. Let's see boron neutron capture therapy. This is also a way where the cancer cells are targeted. And so what happens is that the patients are given boron 10. Boron 10 is safe, it's non-radioactive. However, the boron 10 is going to go directly to the cancer cells. So if you have the cancer cells here, so the boron 10 will accumulate in the cancer cells. It will concentrate in the malignant tumors. Then we're going to irradiate the patient with high energies, with radiations of neutrons with high energy, and this high energy is going to be absorbed by the boron 10. And when it absorbs, which means that the boron is going to capture a neutron. So when the boron captures a neutron, it becomes boron 11, and boron 11 is unstable. So all the boron 11 in the cancer cells become unstable, and they start to emit alpha radiations. And the alpha radiations, because we are talking about the boron 11 in the cancer cells, because the boron 10 had accumulated in the cancer cells only. So the cancer cells will be exposed to alpha particles, and this will kill the cancer cells, right? And the normal cells will not be exposed because the alpha particles have low penetrating power. So these alpha particles produced will not reach the normal cells. So if I were to represent the nuclear equation, so I would have boron 10, and this is going to absorb a neutron. Neutron is this particle, and it gives me boron 11.5, right? Now this boron 11.5, now this is going to undergo alpha decay, so it gives alpha particles. And so the other particle is going to be 3,7. So 3,7, this is lithium, and it also produces gamma rays. So these gamma rays, that's not going to affect the cells because the gamma rays, it has low ionization density. So even if it penetrates in other areas of the body, it affects, the effect of the gamma rays is very minimal. And this isotope can also be administered to the patient by intravenous injection. And normally, this treatment is used when cancers do not respond well to other forms of radiotherapy or chemotherapy, especially when they have sensitive areas of the brain that are difficult to access. And this is also less invasive, as it only requires injection of the boron 10. And the extent to which this treatment is effective depends on how much boron 10 is absorbed by the tumor and not being taken up by healthy cells. So when the tumor cells absorb the boron 10, then the boron 10 is converted to boron 11, which is then going to decay into lithium and alpha. And both the lithium and the alpha are dangerous to the cells. So it causes the death of the tumor cells. The next technique that we'll see is also called the gamma knife radiosurgery. And this technique uses cobalt-60 as a source of radiation. And here you have a series of up to 200 beams that is applied precisely on a target area over here. As you can see here, this is the target area. So you have a helmet which consists of the 200 cobalt-60 sources, and each of these sources will emit a narrow ray of gamma radiation, and these will focus on a specific area of the brain where you have the tumor. So this makes sure that the targeted area is precisely exposed to the radiation, and also the healthy tissues are minimally exposed, because here it's not concentrated, but here all the rays, all the beams concentrate only here. So the healthy tissues are minimally exposed, and it also avoids any surgery. Lutetium and yttrium, lutetium-177 and yttrium-90, they are also used in cancer treatments, and these are very popular because they have short half-life and high rate of beta decay. So they also produce gamma radiations, but because they have a short half-life, so this one has a half-life of around 6.6 days, while yttrium has a half-life of 64 hours. You do not need to remember these, but you have to know that they have a short half-life. And yttrium-90 is used for internal radiotherapy. If you remember, when we did internal radiotherapy, it means that you have a small piece of metal that is inserted inside the body, and then you have the metal that is going to release the beta radiations that will affect the tumors. It is useful for small tumors. Both of them are useful for small tumors. And also when they decay, they produce gamma radiations. So at the same time that it allows the tumor to break down, the gamma radiations produced will allow visualization of the tumor. So if we write the decay of lutetium-177, so this decays and produces beta particles and also gamma rays. And if we calculate it, you will see, so this is 72 and this is 177, and this corresponds to HF. If we write for yttrium, so 3990, this decays into beta particles again, plus gamma rays, and this produces, and this corresponds to ZR. So this is ZR, and you can see HF, hafnium. Let's now see technetium-99M. The M means that it is metastable and that it will undergo radioactive decay by emitting gamma radiations. And this is very popular for diagnosis purposes, and it allows to visualize what is inside the body. And the wavelength of the gamma radiations is very close to X-ray. So you can just use the X-ray machines already existing in the facilities to view what is inside the body. So to view the tumors. So the decay is going to be, so technetium
So this is going to decay to give you the same element, but now this is going to be more stable because it has produced the gamma rays. Advantages of using this element. So energy of the photons produced is low, hence radiation level received by the patient and personnel is low. Technetium has several stable oxidation numbers and readily form complexes with various ligands. The complexes can be administered by injection and delivered to specific organs or tissues. So when it is delivered to the specific organ or to the specific tissues, it will allow visualization of these specific organs, and also it minimizes the exposure to other organs of the body. It has a short half-life of 6 hours, which makes it ideal for medical imaging. A small amount produces enough gamma radiation for most diagnostic procedures, and within 2 days, almost all the radionuclides decay. So the patient's exposure to the radiation is minimal.